Hi, this PowerPoint is to discuss maternal health care in the United States. So, what is maternal health? Maternal health is the health of women during pregnancy, childbirth, and the postpartum period. It encompasses the healthcare dimensions of family planning, preconception, prenatal, and postnatal care in order to ensure a positive and fulfilling experience, reduce maternal morbidity and mortality. Maternal health has been becoming a global concern because the lives of millions of mothers can be saved through maternal health services. But despite the efforts, maternal mortality is still high in most of the developing countries. According to the World Health Organization, as of 2020, approximately 800 women die every day due to preventable causes related to pregnancy. About 95% of all deaths related to maternity occur in low-income countries. Sustainable Development Goal regions such as Sub-Saharan Africa and Southern Asia account for around 87% of global maternal deaths. In 2020 alone, there were about 287,000 deaths related to pregnancy. Maternal mortality has been rising in the United States. A report from the Center for Disease Control and Prevention accounted for 1,205 U.S. women who died of maternal causes in 2021, compared with 861 in 2020 and 754 deaths in 2019. There are many reasons for the increased risk of pregnancy complications that lead to maternal death, ranging from women getting pregnant at older ages, to inequities in healthcare, to a rise in chronic health conditions as well. But about 84% of pregnancy-related deaths are thought to be preventable, according to data from state committees that review maternal deaths. Some factors that increase a woman's risk for maternal morbidity and mortality include the following: existing or pre-pregnancy health conditions such as cardiovascular disease, obesity, asthma, or a compromised immune system, older maternal age, lifestyle factors such as being a current or former cigarette smoker or an alcoholic, having twins, triplets, or other multiples, certain pregnancy complications such as preeclampsia, which is a spike in blood pressure after the 20th week of pregnancy, or gestational diabetes, which is high blood sugar during pregnancy, um, and also racial, ethnic, and socioeconomic backgrounds. Research shows that disparities in the rates of maternal deaths in the United States, with Black women at the highest risk for pregnancy-related death. Several hundred patients die from pregnancy each year in the US, with 3 in 5 of those deaths being preventable. As the graph shows, outcomes are even more stark for Black women due to certain social determinants of health. Structural racism is a manifestation of historical and current oppression that shapes neighborhoods and institutions, which results in differential access to opportunities and resources. For example, housing discrimination caused a lot of low-income and ethnic minority women to live in the same neighborhoods that are also located closer to hospitals with fewer resources, and that often yields poorer outcomes. To that point, nearly one-third of the higher rates of mortality cases in low-income or predominantly minority neighborhoods can be explained by hospital quality. In other words, living closer to a hospital which sees a higher population of low-income or minority patients meant it was more likely a low-income or minority woman would deliver there. Additionally, living closer to those hospitals meant more low-income or minority patients got treatment there, and that hospital quality was lower. Education also plays a significant role as a social determinant because the more educated someone is, the more knowledgeable they will be about their own health, and that will cause them to make better decisions, choose better doctors, and know what the doctors are actually saying or doing for them. So we would like to create an epidemiological study which will seek to investigate the prevalence, risk factors, and outcomes associated with maternal health disparities among Black women in the United States. We can do this by employing a rigorous research design and analysis methods. By doing this, we would aim to provide valuable insights into the epidemiology of maternal health disparities and inform strategies for addressing these issues. We can conduct a cross-sectional and cohort study with a target population of Black women between the ages of 18 and 45 who have been pregnant in the past 5 years. We will utilize healthcare facilities, community centers, and online platforms with a high Black population presence to recruit participants. The benefit of a cross-sectional study design is that it allows researchers to compare many different variables at the same time. Data collection will include a baseline survey in which we will administer a comprehensive baseline survey to collect information on demographic factors, socioeconomic status, medical history, access to care, and maternal health experiences. We will then conduct periodic follow-up surveys over a designated period to track changes in health status, pregnancy outcomes, and healthcare utilization. In order to conduct data analysis, we can employ logistic regression to examine associations between various risk factors, such as access to prenatal care and socioeconomic status, and maternal health outcomes such as preterm birth and maternal mortality. This epidemiological study will contribute valuable insights into the maternal health disparities experienced by Black women in the United States. It will help us to understand the prevalence of maternal health disparities among Black women in the U.S., identify significant risk factors associated with maternal health outcomes, quantify the impact of socioeconomic disparities on maternal health, and help create necessary interventions and policies. The findings will inform evidence-based interventions, policy changes, and healthcare strategies aimed at reducing these disparities and improving maternal health outcomes for this population. Thank you.